for the opportunity to be here. I got a reputation apparently from the governor's debate last week because I'm now the crowd control expert, so don't make me mad. You'll get scolded, just like any good mother would. And one of the things we'll start off with, since apparently we didn't with the governor's debate, and we're going to treat everybody like how we learned to treat each other in kindergarten. So in other words, nobody's going to take anybody's graham crackers. We're all going to sit politely and listen to each other, and then we get an opportunity to ask questions. That way, we get to hear each side, and we get each side an opportunity to present their side of it. Booing and hissing and that kind of stuff, I'll scowl at you. And Mike's tough. He's in the blue. Anyway, what we're going to do, I will welcome the two different sides, two different representatives on the initiated measure 13 to the stage. Tony Ryan. I don't know why it is Tony, but but Tony Ryan is here as Pro 13. Tony is a retired police officer from Denver, Colorado. And what we're going to have, Tony is going to do his opening presentation and give you his position on 13. We'll give him up to 15 minutes. And then Trevor Jones, Trevor, if you want to wave. Trevor is the South Dakota law enforcement official. He's here representing the anti-13 side. He is here as a private citizen, although has been a law enforcement officer here in South Dakota. So each gentleman will present their platform, and then following that, you notice there's little yellow cards or white cards on your chair. If you have questions you would like addressed, go ahead and fill your question out. There's also pencils down there. Mike Osted, who raised his hand in the back, blue shirt, will be collecting those questions, and at the end of the two presentations, we'll go through the questions, and then each side will get 2 minutes to answer the question, and then a minute to rebuttal to each side as we go through the questions. We'll try to get to as many questions as we can with the time limit, because I know that's how you get the best information. So you need to hear less from me, more from the guys. So we'll start with Tony. Thanks for joining us tonight, Tony.
Thank you, and thank you everyone for being here. We're glad to see you. Sure. Should get emergency callers.
Yeah, well, it's actually
I represent the Yes on 13 people for the American marijuana law here in the state of South Dakota. That's currently on the ballot. I'm going to talk to you a little bit about that briefly. Just to explain a few things, there seem to be some misconceptions about what this law is actually about. I would ask if you have the time and you haven't yet done so, that you look it up on the website at sdcompassion.org and read it to see what all the specifics are. There's been a lot of misconceptions passed around about what this law says or allows or doesn't say. So I'd like to first of all stress that this is the most restrictive law that would be in existence in the entire country, including 14 states and the District of Columbia. It allows only for certain amounts of marijuana to be possessed by patients and or caregivers. The patient can either have it themselves, growing it themselves, or, have a caregiver do it for them. Caregivers are allowed the same amount of marijuana per patient that a patient would be allowed to have themselves. Caregivers can only provide for 5 patients maximum. The amount that a patient or caregiver is allowed to have per patient is 6 marijuana plants, and no more than 1 ounce of actual usable marijuana. There's a lot of stories about how much marijuana an ounce will produce. A lot of claims going on there about how much they can get out of 1 ounce. It depends, of course, on how they grow it. I'm here to tell you that most patients, such as my friend Pat back here, in a wheelchair is not going to go out and buy a whole setup for a hydroponic garden in his basement. Way too costly. And so he's not going to be able to produce tons of marijuana out of 6 plants. It's a matter of perception, no matter what you do to do that. Other restrictions on this law have to be established relationship with a doctor, particularly if they're looking for relief from pain. where the 6-month requirement comes in is they've had to been seen by doctors for 6 months, have a history of treatment, have a history with the doctor that they're trying to get a recommendation for medical marijuana from before they can get that recommendation. Another misconception that was once on the website of No 113 was that we were going to have dispensaries all over the place, including next to grade schools, in front of playgrounds, and next to hardware stores, which I never could figure out. They've since removed that from their website because it's untrue. It's specifically restricted in this law. The state is restricted from having any medical marijuana dispensaries. They will not be allowed. The only way is what I mentioned before, the patient grows their own or a designated caregiver grows it for them. Several other things in this that we can address if and when they come up. The best thing to do is to read it. It's really not that hard to read. Gives you all the specifications. Defines caregiver, who can be a caregiver. It has to be somebody 21 years of age or older. No felony arrest history. No drug arrest history. And anytime they step outside the conditions of this law, they lose their right to be a caregiver. A medical marijuana patient loses their medical marijuana card if they step outside the law. There are a lot of what ifs going around about, well, they have this excess marijuana. What are they going to do with it? Well, if they do anything but use it for a patient, they're outside the law. They lose their right to be a patient or a caregiver, and they're subject to arrest as anyone else who has illegal marijuana outside this law. Those are a number of things. There's some things that are going to be showing up reportedly in your local newspaper or somewhere by this weekend from No 113. Talk about Colorado, the state that I'm originally from. I've been here for 7.5 years now since I retired. We talk about how the Department of Health in Colorado says that only 3% of medical marijuana card holders there have either cancer or AIDS. That's all I have to say about it. Didn't say anything more. And they reported in Montana, the Buildings Gazette reports that only 3% of card holders have cancer, glaucoma, or AIDS. And they go on to say the incredible statement that 90% of marijuana get their marijuana for pain. And they say that could be anything from a sprained ankle to a skateboard injury. They don't mention all the other things that people suffer pain from. Debilitating diseases which are addressed in this law and how severe that pain can be. It's pain of spasticity if you have cerebral palsy or MS or fibromyalgia. Very severe pain, not easily controlled. They don't mention that. They talk about a sprained ankle or maybe a skateboard injury. I know you can take a pretty good fall off a skateboard, have a back injury. I think that's up to the doctor. The doctor knows whether or not the pain needs strong medication. I think it's particularly offensive for them to use a lot of quotation marks when they say proponents use, quote, compassion and, quote, safe access when referring to, quote, medical marijuana. In another place they say medical or medical marijuana excuse states, referring to the other states who have medical marijuana. I think that's a little demeaning and could be better stated if they have an argument against medical marijuana. That's just my opinion, I think. They say marijuana has not been subjected to rigorous investigation and clinical trials, unlike all medications with FDA approval. The main reason for that is because the government, under the auspices of the DEA, who somehow has control over the scheduling, controlled substances, refuses to move it from Schedule 1, which says it has no medical purpose, to Schedule 2, even though their own administrative law judge, as far back as 1988, after 2 years of hearings and testimony, told them, you need to put this on Schedule 2, so doctors can prescribe it, and so the FDA can then study it. Right now, because it's against the law on Schedule 1, nobody's allowed to study it. Not the kind of clinical trials and so forth that they're talking about here. It's not possible. The government doesn't allow it. I think it would be nice for us to discover even more about marijuana than we've already learned through the few studies that have been done. Another doctor says this isn't about medicine or compassion, it's about manipulation. Proponents of initiated Measure 13 are attempting to manipulate South Dakotans' empathy to promote their real agenda. I don't know how someone that doesn't know me can even guess what I happen to think about this. But I'll tell you, I've been in law enforcement for a long time. I've seen many, many things that are abused, including legal things, whether it's tobacco, prescription drugs, alcohol, or marijuana. Marijuana is the only substance, the Controlled Substance Act, that is completely illegal and not even allowed to be used as a medicine. There are prescription forms for virtually everything else except heroin, which is on Schedule 1, for all the other dangerous drugs that you commonly hear about. Doctors are allowed to prescribe them. They're only illegal when they are outside a doctor's prescription. Don't see why marijuana has to be that way. I want to see it on Schedule 2. I'd be happy. We wouldn't have to have this state-by-state effort to give patients the help they need if we simply moved to Schedule 2. The issue would be over. As far as this being a first step, as they so often accuse us of, just a first step to get this to be made completely legal, I know that California is trying to do that now after 14 years of having a medical marijuana law. This is not California. The state is completely different from California. Its attitudes, its values are far different. The simple answer to that is it would take another initiated measure for people to put on the ballot by signature or the state legislature to bring up a law and pass it to do anything besides what we want, have medical marijuana for certain patients, as described in this law. I don't believe that the citizens of California are ready, South Dakota are ready to do that. And I'm not about to ask it. You won't see me asking for people to make it completely legal. Looking at it as a medicine, I think the patients in this state that have these debilitating diseases, cancer, and so forth, need to have it. It's often mentioned that there is a medication out there that makes it unnecessary to even think about marijuana. It's called Marinol, which is a synthetic THC, one of the 60-some cannabinoids that are actually in the whole marijuana plant, along with 400 some other compounds. If you look up the physician's desk reference on the internet and look up Dronabinol, or its common medical prescribed name, Marinol, you'll see 2 pages of potential side effects and warnings on its use. One of the first ones is, don't drive while you use this. Don't operate machinery while you use this. Same warning that you see in a lot of medications. It may cause drowsiness, dizziness, etc. So, you know, when we tout something, and then we have Dr. Donald Abrams. Admittedly, he's from California, educated at Harvard, law degree from another top-notch university, doctorate degree from another top-notch university, who tells people I've been treating cancer patients. He's the head of hematology and oncology at the University of California Medical Center in San Francisco. He's also a professor at that same medical school. He says, I've been practicing oncology for years. I personally tell many of my patients that they should use marijuana, especially if they're undergoing chemotherapy. Because for a day and a half after they've had chemotherapy treatments, they can't keep anything down, so how can you tell them to take a pill, such as Marinol? They're going to throw it back up before it can do anything. It's useless. Having talked to many patients, we've been at fairs all the way around the state, setting up our table, talking about this measure. We've talked to many, many people. Some, of course, say, I don't want anything to do with marijuana, and they want to talk about it. That's fine. We have many people who come to us with personal stories and say, oh yes, I'm voting for this because my aunt, my uncle, my son, my daughter, my cousin, my husband, my wife was very ill or is very ill. When nothing else was working, we finally went out, sometimes in the direction of a South Dakota doctor. Very not all of them agree with the South Dakota Medical Association on this. Said, go find some marijuana. And they did, and they tell us about how much better it made their loved one feel. Even though they may have ultimately died from the cancer, they said there was an easier death than it would have been otherwise for the other medications. Or that it actually solved their pain problem with a long-lasting disease. And they didn't have to have their blood checked every month to see if their liver was being destroyed by the other prescribed medication. These are the reasons why I support this. Why I'm in total, full support of medical, not recreational, marijuana for the state of South Dakota. Thank you.